Where am I?
Low.
Well, good morning. We're here for a Board of Commissioners meeting. It is Wednesday, January 13th at 9 a.m. We're in the Senator Hearing Room at 555 Court Street. And as always, we will start our meeting with the Pledge of Allegiance. So if you'll join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, I didn't have our good friend Commissioner Brentano to ask me if I knew where I was I ready to go. But this is our first official meeting without Sam with us. But I think we'll celebrate his going away. We've done that. I think more importantly, we're going to celebrate today with our brand new commissioner. It's no longer elect, it is Commissioner Danielle Bethel, and I want to welcome you to your first board session.
Thank you.
And,
I'm excited to be here.
So glad to have you with us. And,
Absolutely.
I notice I got more distance over here than I do over here. So if you can do this to me just in case. So
You want me to move more closer to
no.
Scott?
I noticed you chose the seat next to legal counsel. So
I absolutely did.
you get good advice. Our first order of business is public comment. We have nobody signed up for public comment this morning. Just want to make sure that if there is anybody here that wanted to make public comment, you can still stand up and say sure. If you want to just come over to the side here, welcome.
Thank you. Where would you like?
Yeah, right in that chair right there. That microphone should be hot. If you can pull it close enough to your mask that we can hear you. Just please introduce yourself for the record.
My name is Crystal Kemp, and can you hear me in the microphone here?
I think we can. Is it
Okay.
coming through? Yeah, okay.
My name is Crystal Kemp, and I'm here today to talk about the concern of the elderly in retirement communities and in the assisted living communities. So, I'm a little nervous, to be honest.
Sorry.
I've never done this before in my life.
You're just
We-
talking to regular people.
All right, okay, so.
Yeah, we've all been there.
Here's-
Trust
all
us.
right, so, I know you guys don't know me. I am a mother of three. I'm a realtor. I'm just a regular person in our community. I live in Silverton, Oregon. My dad, who is 62, he is in an assisted living facility. He's been there for 2 years. I'm sorry if I cry. He's dying, and I can't see him. I take that back. I was able to see him a couple times now that he's actually on his deathbed. He's been in the facility for a couple years before this COVID thing. We were able to go in. We were able to bring him lunch, hang out with him. I brought my kids in. We hung out. We decorate his room every holiday. We go in. We bring him pizza and all the things that, they don't get in there. He's in the facility at a young age because he had a stroke when he was 42. Gradually, he's just declined. So I noticed, he's been really kind of having really good spirits through all of this when it all kind of started like back in March, I think, or so when things really started getting closed down. I'm sorry, Dad, we can't come see you. We would visit through the window. I'll bring him lunch. We'll hang out outside the window. My kids want to know why they can't go see their grandpa. Over the year, it's been really hard on him to stay in good spirits. Eventually, what's happened is they're not allowed to leave their rooms. Their rooms in this specific facility are probably about 20 square feet. There's a room enough for a bed and a chair and a TV and a shelf and their clothing. He cannot get out of bed without assistance. He has to be in a wheelchair. So because he's confined to this space, every day, his day consists of, hey, Terry, would you like to get up today? We need to get you out of bed. He says, why? What's the point? To get out of bed and sit in your wheelchair? To watch TV all day? When before they had activities, they had bingo and they had I don't know, just all the little silly things that they do in the nursing homes for these people that this is all they have, this is their life. And just to get out and, you meet somebody in the facility that you maybe have something in common with, so now they're buddies and they hang out and they go and they visit people and this is their life. They're making the best of it that they can. And every little piece that they had left to live for, that tiny little piece has been stripped from them. Their family, their grandkids, their activities, their outings. They used to put them all on a bus and take them out somewhere. They would take them to the fair, or they would take them to, little events that we have around our community that are amazing, Saturday markets and all the things that we do. They have nothing. They sit in their rooms every day. They maybe get out of bed. They sit in their wheelchair. They watch television. And then they get back in their bed. And I don't know about you guys, but I feel like something needs to change. And I don't know what I can do, but that's why I'm here today. Because around Thanksgiving this year, my dad decided not to get out of bed anymore. He said, "Why? What's the point?" And now he's declined so much that it'll probably be maybe another week. And I've already lost my mom 7 years ago, and it's hard. I'm so sorry, you guys. Trying to hold it together. So I really feel like the restrictions that we have in place, I understand they're for safety. I understand we're trying to protect. I understand all of these things. But there's got to be a change. Thank you so much. If we can go to Costco, and we can go to Walmart, and we can go do all these things, but our elderly have to be stuck in rooms and can't visit with people, I don't understand. I don't know how we can make a change. But something has to change. Something. Because these people are not thriving. They have nothing. They have to at least be able to see their family members. I don't know, but I'm here today to hopefully just maybe put something into place. If anybody else wants to stand up beside me and behind me and take a stand as well, I think it would be amazing if we could just put something in place. Because these people, they're depressed. I have friends that are in the medical field. They're caregivers. They say these people are not thriving, they're depressed, they're giving up. And I understand, they're at end of life, and it's sad anyway, but to take what little piece of life they had left is just heartbreaking. And we say it's just to save their life. For what? There's nothing there. They're giving up. They've stood strong for almost a year now. And something needs to change. So I'm here today to just put that voice out there.
Crystal, thank you. We typically in public comment don't respond, but I can't help not respond today to your hurt. I can feel it inside. I've lost parents, and it's probably one of the hardest things that you ever go through. And I know that in the circumstances that we're in today, it's even harder because of what you just described. I can't imagine what you're going through personally with your kids and looking through a window. I think your voice is heard here, along with other voices that we have heard throughout this pandemic. And we will continue to send your voice on as we have an opportunity to do that with people who are the regulators and that are setting the rules down, that sometimes we need to be a little flexible so that we can make exceptions to the rules, but still protecting those that are around us. So I just I'll continue to lift you up and your family in prayer. I don't even know you, but there's so many people like yourself that are suffering during these times, and it's a really, really tough time, so I don't know if any...
Yeah, I'd echo everything you said, and like Commissioner Cameron said, we don't usually respond to public comment, but you're here, and I think I'd like to give you some answers, or at least tell you sort of where we are in this journey, because I've been frustrated with the state's response to COVID since the beginning, and one of my frustrations, and one thing that we ran into in April or May was these care homes are regulated by DHS, Department of Human Services. And so we don't really have jurisdiction over them, but we're the local public health authority. So to a certain extent, we're responsible for all things that happen in our county related to health. And we had a really bad situation where, I forget, it was like 20 or 30 people in a care facility died of COVID. And the state basically didn't look into it. They didn't know about it. When we asked for information, they wouldn't respond to us timely. I mean, it was like, it was wild. And so we asked them to come and tell us what their plan was. And they showed up and they didn't really tell us anything. They didn't give us any answers. They told us that they had formed a team to start looking into this like weeks after it had all happened. And I think eventually they started getting their act together and started figuring out like, okay, we need to actually investigate how to keep these places safe. And my frustration was the answer became, we can't let family in to see their relatives, when what we discovered is most of the problems were employees bringing the disease into the facilities from their homes, right? So instead of focusing on making sure the employees were safe and that they weren't transmitting the virus, they locked down the family and the residents. And we haven't really gotten past that. That's still basically the state's position. My hope is, because the federal government is giving direct vaccine to these facilities, that basically there won't be any justification for that anymore, that now that people are able to get the vaccine, they should be able to see their family, because they're inoculated. So I think we're close, but I share your frustration. I mean, the last 6 months, basically, I don't have any explanation for. And we've called the state in, and we've challenged them and asked them, and we'll keep doing that. I want you to know that. But that doesn't fix your problem. And like Commissioner Cameron said, I just want you to know that we're going to pray for you. And
I mean, I understand it might be too late for my dad, but if I can help somebody else, that's my goal. And if I can help these people, that's my goal. So, thank you.
Commissioner Bethel?
Yeah, Crystal Ann, we talked on the phone last week, and I really appreciate you finding the courage to come down here. I know this is really difficult. And losing a parent is remarkably challenging, and especially during COVID in a space where you can't be with them through the transition, and I'm really sorry for that. I'm equally frustrated, as Commissioner Willis said, with the way the state has been handling all aspects of COVID, but specifically our most vulnerable populations. You've been informed on kind of what our role is in that and what our limitations are, but that's not going to stop us from speaking out. And you coming today and sharing your story matters, because people are going to hear your story. I think that's what's lacking, is the humanity of this process. And today we all have a call at noon with the Oregon Health Authority, and I assure you that this is going to come up. The federal government is handling the distribution of vaccines down to these facilities, but I don't believe that they're being deployed well enough and fast enough into those communities with the state support. And so I'll do everything I can to lean on that to make sure it happens, because it is critical. Just keep in touch, and if there's anything I can do for you personally, please let me know. Thanks for coming.
Thank you, Crystal.
If you don't want to stay, you don't have to, by the way.
But
You can. Yeah.
we love to have people here with us too, and know that our arms are extended. Because Katrina, would you like to do a presentation? I know that's a hard one after what we just heard. So we have a presentation on COVID-19 update from Katrina Rothenberger.
Good morning. Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. As of today, January 13th, there have been 15,740 total cases of COVID-19 since the beginning of the pandemic in March. The percent positivity rate is 9.4%, and that's also since the beginning of the pandemic in March. 233 people have died, and there are 57 Marion County residents in the hospital with COVID that we're currently monitoring. For Region 2, which includes Marion, Polk, Yamhill, Lynn, Benton, and Lincoln, there are 193 adult non-ICU beds available out of the total 787 beds, and 52 adult ICU beds available out of 126. And there are 74 individuals hospitalized in Region 2 for COVID. Last week, Oregon received 50,700 doses of the Pfizer vaccine and 25,000 doses of the Moderna vaccine. Of the Pfizer vaccine, 44,850 went to hospitals and 5,850 went to skilled nursing facilities. And of the 25,000 Moderna vaccine, they went to hospitals and local public health authorities. To date, 115,060 Oregonians have taken the first dose of the vaccine. And we know that at least 10,679 of those people live in Marion County, with 527 people fully vaccinated. Of the large counties, Marion County is administering these vaccines at a faster rate at 307.08 people per 10,000. And then I just wanted to comment briefly on the vaccine rollout for the long-term care facilities in Marion County. We have been a little frustrated with the timing of these vaccines, and so we're able to reach out, whereas before we were told do not reach out to the long-term care facilities in order to offer these vaccinations, but we did get the go-ahead to reach out to those that don't have their vaccines scheduled until later in February. So as our county has been extremely protective and wanting to see these most vulnerable adults immunized quickly, it's unacceptable, and so our staff is reaching out to these facilities to see what we can do to get shots to arms. We do know some of them probably have gone to the fairgrounds to get immunized because the rollout has been slower than what we would have liked. Currently, the vaccines are available for individuals in Phase 1A only, which includes healthcare workers, residents and workers of long-term care facilities, law enforcement, emergent EMS and first responders, personal support workers and caregivers of individuals with intellectual and developmental disabilities. Individuals who are a part of Phase 1A can be vaccinated at Salem Health's COVID-19 vaccine clinic. You must live or work in Marion County in order to be eligible, and the hours vary depending on the vaccine availability, and we just encourage everyone to check out the Salem Health's website prior to going down to the fairgrounds. Yesterday, we received some updated guidance from CDC, and then Governor Kate Brown announced that Oregon will be expanding the COVID-19 vaccination to include all individuals age 65 and older. And this change will go into effect on January 23rd. This also includes child care providers, early learning, and K through 12 educators and staff. And we really want to ask that our community members seek vaccines in the community where they live or work. Each county is allocated a limited number of vaccine based on the size and our population. And so getting vaccinated in the proper phase in the county where you live or work will help ensure the fair and equitable distribution of vaccine in your community. Marion County has had a high incidence of COVID-19, and so we're really making sure that we can get the vaccine rolled out quickly here in Marion County. It's still really important for us to keep taking these same precautions as we're rolling out the vaccine, wearing a face covering when around others, physical distancing, washing hands, and staying home if you're sick. We'll be hosting a Facebook Live event on Thursday to just talk about some general information about the vaccine. We want to know what questions people have so we can start getting some messaging out and help people make an informed decision about whether or not they want to take the COVID-19 vaccine as it becomes available to them. And then we're also looking for a new testing location with the setup at the fairgrounds to prioritize vaccine distribution. We're looking for some alternate locations for testing events. Testing statewide has gone down as we shift towards the very important population health intervention of vaccination, which we're all really excited about, and shifting resources to support fast rollout of vaccine. I think that's all I have today. And if anybody needs any help with self-isolation, we're still here to support with those wraparound services. So there's been a lot of changes in state and federal funding, but we still do have some resources to help support people who need to self-isolate. It's really important to do so if you have a COVID diagnosis. And just wanted to give the phone number. It's 503-576-4602, and that's our warm line. So if folks need that assistance with self-isolating, please give us a call. So.
Can I repeat that one more time?
Yes, our warm line, 503-576-4602.
Great, thank you. Commissioner?
Yes, I have a question. So you mentioned a Facebook Live event tomorrow. What time is that going to occur? And then what county Facebook page is it going to be on?
It'll be on our Marion County Health and Human Services page at 12 o'clock.
Thank you.
Good.
I'm good.
Yeah, Katrina, thank you. I did have one question. You said, I think it was 10,789 Marion County. How did we compute that number? Is that based on shots administered at the fairgrounds?
10,679. This is the number that's reported on the Oregon Health Authority data dashboard. The last update was midnight on January 12th. And so it is most likely underreported. We are given about 24 hours. The goal is 24 hours. You'll put in the doses into the alert system. And so that's where Oregon Health Authority is drawing that information from, is from alert, which is where we put in all the doses of vaccine given. So
just to clarify, that's if a clinic gives a vaccine, they just put in the number. They don't track the residents of that particular person as being from Marion County?
I'm not sure all the fields that go into alert. It's name, date of birth. We want to make sure that folks who received the vaccine the first time received the second one, the right dose the second time. So we have enough identifying information to be able to tell which dose to give them next time if we have to. And then I do believe it includes the basic demographic information.
Could we find that out?
Sure.
That would be really important information based on some things that are happening. And I'll just say this, I'm going to withhold any judgment. I'm just going to state a fact. I talked to an individual last night who's a Marion County resident who has interaction with somebody with disabilities or mental health issues, and they went on Friday to the fairgrounds, waited 3 hours in line to get their vaccine. And in those 3 hours they stood there, they talked to many different people who were not from Marion County that were going through our vaccine clinic. I'm watching the news. I don't normally watch the news, and the Portland media continues to promote the Salem Fairgrounds as the place to go to get vaccinated. So last night I actually called Salem Health, my contact there, and said, could you start checking IDs, because we want to make sure that the people from Marion County are able to get these vaccines. And we think that the state has made this the vaccine site for metro. I haven't heard about anybody setting up clinics like this in the metro area. I would think Multnomah County could get their act together and open the convention center or someplace in Portland. There's so many other places that this could be replicated. So I just wanted to make sure when we look at those 10,000 or however many it is, if there's demographics that show what cities or counties that people live in, it would be really good for us to know that we administered X amount of places. I spoke with another commissioner south of here this morning, and they haven't even got through their 1A, what is it, the emergency frontline people. So we're doing really good, but I also I think because we're doing good, it's a double-edged sword here, and people are flocking to try to get their vaccines here, and we need to do a better job of making sure we prioritize the people who are qualified to get these vaccines.
And I just wonder, with the number of people outside of Marion County that is being vaccinated, that are being vaccinated, if we should be reporting back to OHA that we need that influx of vaccine to support Marion County. Are you doing that? Is that even possible?
Yeah, we've had some conversations with OHA last night about local resources being used for statewide or regional efforts and how we need to have a broader conversation about when and how that happens. So yes, the vaccines that come here need to support Marion County, and if they're not, then we need additional resources.
It's a touchy situation because we've got this thing ramped up, and you got to have the supply of vaccines, needles, syringes, and you have to have the supply of people. So, I mean, we need to get vaccines in arms. We know that. It doesn't do us any good to have 20,000 vaccines sitting on a shelf in a hospital someplace. So, but we do need to balance this with the proper checks and balances and accountability for people that should be getting them at the right time. So I thank you for all you're doing, and the partnership with Salem Health has been fantastic. And now, and with the State Fair the State Fair, they have been wonderful in just opening up and getting things done without even questioning the cost, et cetera. So,
Well, Mr. Chair, if I may,
Yeah.
just to beat a dead horse, Portland got directly allocated, I think, $114 million at the beginning of this pandemic. And Multnomah County, I think, got another $50 million or something. And so there is this thing of like, we have all these resources that are going to the metro area, and yet they're relying on us to administer the vaccines. That doesn't make any sense. And so I think it's just something to remind the state and OHA that if you're going to give all the money to Portland, you better expect some service out of them.
yeah. I just can't believe that they haven't opened the convention center or someplace up there doing what we've done in a matter of 2 weeks.
I think you can believe it. Let's be real. They've been behind the 8 ball this whole time.
All right, okay. All right, we got to get on with some really good business. Although, yes, go ahead. Sorry.
I have up on action. Can I just stick around right here?
You have what?
I'm up on action. Can I just stick around?
Sure,
She's
you can.
next.
In fact, you can sit right there because we're going to go through the consent agenda. You don't have to move. And I'll entertain a motion
Yes, I'm being hazed into my first meeting with my very first consent
from
calendar.
the vice chair.
Yeah, Vice Chair. So, Mr. Chair, I make a motion to approve the consent calendar, and I'm going to move through that. Health and Human Services to approve an order reappointing Carrie Fisk Sessoms, Cleo Frofe, Wendy Holohan, and Ray Wilson to Marion County Local Alcohol and Drug Planning Committee with terms ending January 31, 2023. Public Works, approve amendment number 6 to the contract for services with Cavanta Marion, Inc. to allow Cavanta Marion, Inc. to contract directly with third-party firms for metal recovery through July 1, 2021. Sheriff's Office, approve a resolution extending the suspension of Marion County Sheriff's Office Jail Capacity Management Plan through March 31, 2021, due to the COVID-19 emergency, and authorizing the Marion County Sheriff to restrict lodging of arrestees and to allow release of inmates as appropriate to maintain health and safety. Tax Office, approve an order for a property tax refund in the amount of $63,184.99 to CIC Equities of Oregon, Inc., account number 524216. Also under Tax Office, approve an order for a property tax refund in the amount of $33,403.94 to CIC Equities of Oregon, Inc., account number 524217. And also under Tax Office, approve an order for a property tax refund in the action of $34,147.99 to WAFD Bank.
I'll second the motion.
We have a motion and a second. Any further discussion? So, Chair, I just wanted to make a comment on the Covanta contract. I contacted Brian May just to clarify that. As we know, we've been under contract discussions and negotiations there. And what that metals contract was, it was an old contract that we had. It expired. Covanta is able to get a better contract, and it doesn't change any of the split between us. It's just a better contract that Covanta was able to get. So I just wanted to make that comment that Brian gave us that information under consent calendar.
Thank you.
Any other further discussion? Seeing none, all those in favor of approving the consent calendar signify by saying aye.
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 Aye. Okay. So you didn't go anywhere. Katrina, you're right back up.
Thank you.
This is under an action item to consider approval amendment number 1 to the contract for services with HIV Alliance in the amount of $141,210 for a new contract total of $191,210,000 for linkage of care for newly diagnosed HIV positive individuals through December 31st, 2022. Welcome.
Thank you. Again, Katrina Rothenberger, Marion County Health and Human Services Division Director. So this new contract total is $191,210, and it has increased from $50,000 to because this will cover a 2-year period. So in this next year, 2021, the total award amount is $68,342, and then the year after is $72,868. So we're doing a 2-year grant this time because they are our subcontractor as part of a 5-year early intervention services outreach grant that we received from Oregon Health Authority. And this grant went to high incident counties across the state for HIV. In 2019, there were 10 new cases of HIV in Marion County, and then in 2020, the still preliminary data, there were 18 new cases of HIV here in Marion County. We've been working with HIV Alliance for a while now. They do some of the services that Marion County no longer offers, so we don't do the case management services anymore for people who have new diagnoses of HIV. And what this person will be doing will be working, they're bilingual, they're an outreach specialist, and they engage high-risk individuals in testing and other preventive treatments, including in-person outreach education and rapid HIV testing, and just engaging people who have fallen out of care, so they might not be current on their HIV medications anymore, referral to other programs that may help support them in their health. We're also including, so I'll back up a little bit. The 50,000 was supporting a 0.65 FTE, and their remaining 0.25 FTE was supported by another funding source. And so the reason for the increase is we're moving from a 0.65 FTE to 0.9 FTE and expanding that rapid testing more out in the community. So now that we have a path forward out of the COVID pandemic, we're anticipating that we'll need to do some more rapid HIV testing in our community because we have seen our numbers increase a little bit from 2019 to 2020. So this is another one of the health issues that exists in Marion County that has kind of been under the shadow of COVID, but something that we really need to pay attention to because of the health consequences if left untreated.
Questions for
Yes. I'm going to be full of questions for a while. So I'd love to know what a little bit means in the definition of an increase. Not necessarily right now, but whenever. And then also, I'd like to know what kind of outreach education the health department does into the communities specifically impacted by this, and if there's opportunities there.
Okay. Yeah, primarily, so before I started working here, this grant has been around, and we purchased a mobile van to do rapid testing out in the community. So that van has been parked during COVID, but that is one of the things that we would do is go around in the community and do some rapid HIV and other STD testing and just provide health information. But we can certainly talk about a little bit more with Dawn, the program manager, too, on what the program looks like. It does support almost 3 FTE in the health department as well. And the grant does end in 2022. There may be some options for renewal if that's what we choose to do.
Thank you.
Mr. Chair?
Yeah,
If I
yeah.
may.
Commissioner.
I have 2 questions. First is on the mobile van and this program and the 3 FTE. So you said that we don't do this case management anymore, we contract it out, but we still have 3 FTE related to this early intervention and services outreach grant, is that right? Is that the grant that you're talking about?
Yes.
So does it do more than just this program then?
The 3 FTE, do they do more than just the EISO program?
Do they do more than just the HIV linkage of care for newly diagnosed HIV individuals? I assume the answer is yes.
Yes.
Can you talk a little bit about the program generally beyond this specific contract?
Yeah, so this grant has been underspent because we have been focusing on COVID. So previously, these FTE were focused on the mobile van in the community. So that was supporting a nurse, office specialist, and another person who would work on HIV prevention. And also, if a new case is reported, we are still required to do the follow-up, just like we do with COVID, the contact tracing and case investigation.
And that's different than what the HIV Alliance does, is that right?
Yes. HIV Alliance is more out in the community, working directly with people who, after that HIV diagnosis. So
Right.
that's kind of where we hand off.
Making sure that they get the treatment they need, right?
Yes.
Okay, and so the other question I have, and Ryan, this is sort of for you too, I know you're not up here, but this is more of a process concern that I have. So one of the things that I saw with this contract was that we were just given the amendment language in our packet.
Okay.
It's just like the 1-page amendment. But the original contract was for $50,000, so it didn't come before the board. So the board never saw the underlying contract, and I had to request that additionally before this board meeting. So in the future,
Okay.
if that's a situation where we haven't seen the underlying contract, could you make sure that it gets put in here when we see the
Yeah,
amendment?
absolutely.
Okay, thank you.
Any other? Good. I remember the discussion on the mobile van because Commissioner Brentano, he had some comments about that. I specifically remember that was probably 3 years ago or 4 years ago. We had that discussion. Is that when we acquired that? Been a while.
Believe so.
Yeah, I remember this. Okay.
I met their team in
Yeah.
2019 at an NAACP meeting.
Yeah.
They came out. So I saw some of the education and outreach. Just so you know, I've seen it. I'm just curious what it looks like now.
Because his
Well,
question
it's
was,
been-
when is it going to show up in sublimity? I remember that. All right.
Mr. Chair, I move that we approve amendment number 1 to the contract for services with HIV Alliance, the amount of $141,210 for a new contract total of $191,210 for linkage of care for newly diagnosed HIV positive individuals through December 31st, 2022.
Sorry, I'll second it.
That's okay, I will.
I was
you know.
moving on already in my head.
Yeah. All right, we have a motion and a second. Any further discussion?
None.
Seeing none, all those in favor signify by saying aye.
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 Aye. All right, that is done. Next is under Juvenile Department. I see Troy walking up here. Consider approval of incoming funds intergovernmental agreement with the Oregon Health Authority in the amount of $1,100,000 for behavioral rehabilitation services through December 31st, 2022.
Good morning.
Oh, you're over there.
I'm right
here. I said I see you walking up, and I was just assuming you're walking up.
I'm like a ninja sometimes.
It's like ninja.
Troy Gregg, Juvenile Director for the Marion County, Oregon. Thank you for letting me be here today. I know, it always kind of feels like the football intros and everything, so it should be done. So yes, this is for approval for intergovernmental agreement with the Oregon Health Authority, which the contractor is DHS. And this is my best Austin Powers for $1,100,000. Dr. Eagle right there. But this is for the GAP program, the Guaranteed Attendance Program that we have on campus, which serves youth in an effort to not get them deeper into the system. So the GAP program is a 90-day shelter program. We BRS level services and behavioral rehabilitation level services or treatment groups and programming for those kids. It is a free service to the families and the kids, and it is a voluntary program as well, but it's, you know, as the name suggests, it's the gap between getting kids deeper into the system. And we've done a lot of work and a lot of research over the years, and questioning is this effective? Is this something that we need to do? And the answer to that is yes. Majority of the kids that end up going deeper into the system, the Oregon Youth Authority, have come through GAP. And so you can look at that one of two ways. It's like, are we doing something wrong? Are we doing something right? And my answer is we're doing something right because we're targeting the right kids, the kids that are getting further into the system, and we're able to intervene early on. Our goal at the Marion County Juvenile Department is to stop the bleeding at that point in time, to stop the kids going deeper into the system. And the Guaranteed Attendance Program is that one opportunity that we have to be able to do so, to intervene early on, impact youth and families. And so this is obviously the monies that we receive from the state for doing those services and reimbursement back. And so looking for approval. Are there any questions?
Go right ahead,
Yes.
Commissioner.
So are you saying GAP as in an acronym, or just like in general, there's a gap in services that helps them go deeper into the system?
It blends really both well. It's an acronym, and so it's called the Guaranteed Attendance Program. It's nice. It's real easy for us to get shirts and sweatshirts for the staff because we just go to the Gap. But yeah, and so it is. But it's also that piece where if there's a gap in services and the things that the kids need, I mean, that's really where it kind of targets. And the goal behind the Guaranteed Attendance Program, as you talk about it, it's got that kind of school flair to it. And the intentional purpose behind it is that the kids go to their home schools, and then they come back and we do services for them in the morning, in the evening, and then on the weekends, where they also have an opportunity for home visits and everything like that as well. And so we've adjusted, obviously, during the COVID world. We have educational advocates that are working with those kids doing the homeschooling, online schooling and everything right now, instead of them actually going to schools with it. But it really is that piece of, let's bridge the gap where these kids are at before they get deeper into the system and dive into the state care and custody. And then that becomes more of a burden on families, because then there's, as we kind of were talking about yesterday in another meeting, is that the state can then start taking child support from families. And so it's a bigger impact to do it that way. So for us, it's an opportunity to work with the families of Marion County, get them the services that they need, help those kids learn some skills that can help them ultimately be successful in the future.
How many kiddos are you serving in the program?
So the program will hold up to 22 youth at any given time, males and females. We have 2 sides and 2 houses or housing areas back there for them. COVID has impacted us quite a bit with that. We've been really trying to be mindful about it. I think we're up to about 12 to 15 right now. Usually we're pretty full with that. We were down to about 1 or 2 during the first initial outbreaks of COVID, but we're working really hard to make sure that we keep that family connection on top of all that while keeping kids safe at the same time. And so that's been kind of the biggest challenge in kind of coming through, is managing through COVID and the challenges of kids coming in and out of the community and figuring out how we do that best. But 22 is the number of kids that that program could serve. And typically, over the years, it's been pretty close to being full most of the time.
I have one more question. How do kids make their way into this program?
Several different ways. For the most part, when kids come into the juvenile department system, initially they're going to have a probation officer that works with them and their families, and it ultimately comes through that point of the kids may end up in detention. And so this is a great deterrent to get kids ultimately out of detention too, because if the kids can't go directly home because whatever happened could be related to their crime or just a lot of challenges and different things that are going on at home, we can get them out of detention and then into GAP, into a community program. The other piece is that kids may be struggling at home. They're not able to follow the rules. They're not able to do it. The parents are getting really frustrated. And again, before things turn worse, we want to do what we can to intervene and hopefully impact and make a difference when it comes to working with those kids, and the staff do a great job with that. So it really just kind of comes through. It's kids that are on probation or in the process of probation, and the referrals come through their probation officers and just the work that we do with them. And so, but again, detention is a lot of decent deterrent for kids to get out and get back into the community program too. So you see kind of both avenues. We do get some community kids that are ultimately struggling that we come bringing in, and then you get a lot of kids that are in detention for some reason and things are not going well at home to get them back in.
Thank you.
Yeah.
If I may. Troy, I always learn something whenever we visit. This is separate from like the workshops that you have? That's a different program, is that right?
Right. So you're referring to the alternative programs,
That's
which
it.
is our work programs and different things we have on campus.
And so the kids in GAP, they don't get to participate in that, or they do?
It's a great question. So, however, they do. And so for us, historically, what it's been is, when the kids are out of school, spring breaks, different things like that, the first priority for us in the guaranteed attendance program, the GAP, is that kids are going to school and that they're doing their schoolwork, they're engaging, we're getting them caught up on the areas and things that they need. And then it's work, community service, restitution, everything that's engaged with that. And so those kids do engage with that, especially during the summertime. We have work crews that come strictly from GAP out of that way. And it's both, both skill building, restitution, community service, all those things take place, and then also an opportunity for kids to earn some dollars as they do that as well. But right now, it's the balance between they're either going to school, working with our ed advocates to do that, or you have kids that are doing AP program. And for a while, because of COVID, it was just strictly GAP kids, and we had restricted a lot of community kids coming back in to do those community service and work stuff. So, but yes, absolutely.
I think the AP program's fabulous. And
What's that?
I'm a big fan of the AP program, and I just think that's
As am I.
very healthy for the kids to be able to do that kind of work. I thought I had another question, but I don't. Thank you.
You're right.
So after last night's windstorm, that AP program's probably going to be pretty busy.
We'll take a lot of trees, and we're good to clean up and do all those things. And so
Yeah.
it's a great opportunity. And like you said, it's good, hard, hands-on work, skill building, stuff that will benefit the kids wherever they go and whatever they do, and a lot of different opportunities for them in that program. It's really broad, so, which is another discussion.
And Commissioner, there's an opportunity to go out and weed eat with those kids. I did it.
Happy to do
It's
it.
fun.
He
Yeah.
did. He went on a work crew.
Weed eat, and then we cleaned out ditches somewhere for Public Works. Some of our what do you call it? The stormwater programs. They've used the kids for that. It's an interesting, and they work hard. They really do a good job. So.
I think Risk might frown on me using a chainsaw, but I am more than capable and willing, absolutely.
Yeah.
A lot of wood cutting and
I
staff.
do have one question.
You found the question?
I did,
All right.
sorry. So this contract, does this pay for the whole GAP program, or is it sort of a blended funding thing?
So close typically, a little bit more of juvenile justice intervention dollars come through that way. Community criminal justice dollars help pay for that program as well. It is based on a per kid. So when the numbers have been low, like it is with COVID, we have to find a balance and try to figure out to make
But
that
general
up.
fund doesn't fund this program.
Not, there might be one, I'd have to look specifically, there might be 1.5 positions or something like that, but primarily not.
Primarily not. Okay.
Absolutely not.
Great, thank you, Mr. Chair.
All right, good?
Good.
Troy, we'll go ahead and take a motion, but thank you for your service and your leadership over there. Appreciate it.
Mr. Chair, I make a motion to approve incoming funds for intergovernmental agreement with Oregon Health Authority in the amount of $1,100,000 for behavioral rehabilitative services, December 31, 2022.
I'll second the motion.
We have a motion, and a second. Any further discussion? Seeing none, all those in favor signify by saying aye.
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 Aye. All right.
Awesome, thank you
Your
guys.
1.1 million is coming.
Sign me up for a tour.
We will.
Okay.
All right. Our next order of business is under Public Works. Oh, good. This is going to be a show. I love it when Ryan comes up. To consider approval of public improvement agreement with Fairline Bridge, Inc. in the amount of $4,064,862.90 for replacement of the bridge on Silverton Road over the Little Pudding River. This bridge keeps coming back. Welcome, Ryan.
Thank you. For the record, Ryan Cruther, Marion County Capital Projects Manager. And this does keep coming back. This should be the last time we come to you because this is our construction project with Fairline Bridge. So the project is located on Silverton Road, just east of Salem, near 64th Place. The scope of this project is to replace an outdated concrete bridge. It was originally built in 1922 and expanded in 1948. We will also construct a center turn lane throughout the project that will go to 64th Place. So, to facilitate a speedy construction, we're going to close the road for a portion of our construction period. The closure will include a detour, or 2 detours actually, one on Hazel Green Road and one on Sunnyview Road. We'll also construct temporary signals to facilitate traffic movement through the project. Yeah. And along with that, we are going to release some press releases. We've talked to the public about this project through the years. Everybody knows it's coming, but we're going to make sure we send out a few more press releases before we do any road closures. So we got our bids. The low bid was from Fairline Bridge Incorporated. The bid was $4,064,489.25. This is a federal project, so the federal funding will cover 89.73% of the project. County funding will be required to cover 10.27%, or $417,423.05. Our schedule includes construction, assuming you approve this contract, between January of 2021 and June 30th of 2022. And then the road closure that I'd mentioned, we've limited it to no more than 200 continuous days. We also required that the contractor have the road open by November 20th of 2021 in order to have it open before the holiday season in Silverton. And with that, I'd ask if you have any questions.
So is this a federal transportation reimbursement type funding structure?
It is. It's funded through the local bridge program.
Okay, and so do they give you all the money up front, or is it a process over time? Does that work?
It's a process over time. We actually ask for reimbursement as we spend the money. So we've already been reimbursed for our preliminary engineering portion of the project. That's when we're doing design, we're obtaining any right-of-way needed. We have different phases, and so we'll ask for that money back as we actually spend the money.
And then my last question is about notification. So I drive to Silverton pretty regularly, and I, am an autopilot driver because I've done it for many, many years. And I'm a bit concerned, of course, I'm sure you've done all the due diligence, is to tell the residents really early before they even get to Hal Prairie that they need to turn one direction or the other because they can't come through. What does that look like?
So we actually, and I don't have it with me, but we have a detour plan, so there will be detour signing. We also plan to put out what we call a portable PCMS, portable changeable message sign. I don't use the actual terms very often.
Big highway signs.
Big
that turn
highway
orange.
sign to notify people that it will be closed. And like I said, we're going to also put out press releases. We've been in contact with the city of Silverton. as well. And so we're really going to try to make sure everybody knows it's coming. We've been holding off for now until we get the contractor's schedule so we can say exactly when that closure is going to happen. And so we don't want to give any dates until they actually tell us exactly when they're going to close the road.
Okay, thank you.
This bridge was supposed to be built, I think, last year, and we ran into some right-of-way issues and decided to put it off. And there's been town hall meetings out there,
Okay.
but it never fails. And I think of this, the construction that even happened here in Salem with the police station being built. My habit is to turn up Broadway and then go to the left and then go up, you know. And I don't know how many times I still did it and went, oh no. You know? So it's no matter how well we message it, we're gonna hear about, okay, what's going on here. So I really appreciate the signals. I think that's gonna make a big difference. In fact, Brian, do you wanna go back to that slide where you're showing those, because you skipped over them really quick. So Commissioner, this plan's been laid out, I think, over a year ago for how they're gonna detour. So the signals there are gonna make a big difference, temporary signals. And I know what's gonna happen if we call them temporary. When we take them back down, people are gonna go, why don't we have signals there? So it'll be interesting to see how that goes.
Well, and
The farmers might not, sorry.
As much as people might get mad at us for this, I'd rather they get mad at us for this than have a 100-year-old bridge collapse and people die.
I wrote that down, 99 years old.
Yeah.
Wow. Do bridges we build today last 100 years?
We hope so.
Yeah, okay,
Yeah.
good. All right, and I always appreciate you coming because I always get a slideshow. So we'll take a motion.
That's what he meant by this show.
Yeah.
Mr. Chair, I move that we approve the public improvement agreement with Fairline Bridge Incorporated in the amount of $4,064,862.90 for the replacement of the bridge on Silverton Road over the Little Pudding River.
I second the motion.
A motion and a second. Any further discussion? The only thing I would say is if our former colleague is watching, this is the Silverton Bridge and not the Scotts Mills Bridge. All right.
But I'd love to be brought up to speed on that Scotts Mills Bridge, just so we're clear.
Oh, okay, yeah, I shouldn't have even brought it up.
The
All
San
right.
Brentano
It's
Memorial
the one
Bridge.
priority that's painted on my wall in my office.
Seeing no further discussion, all those in favor signify by saying aye.
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 Aye, all right, thanks, Ryan. Thank you. Okay, you know what, it is a new year, and we will read the calendar. And I'm gonna read it, just so you know that I can do it. Because it'll probably be the last time.
This is leadership. You're
I'm
showing some
thrilled.
leadership
The
here.
last time that I probably do it as the chair, so we are, obviously, you're here for our board session. This is the calendar for January 13th through January 20th, 21. Later on today at 11:15, the Board of Commissioners have a policy meeting, a location here on the 5th floor in the Commissioners' Ballroom, boardroom. I like to say ballroom. On Wednesday, today also at 12, the County Commission has a Q&A with the Oregon Health Authority. That's a virtual meeting. Oh, really? Do we want to talk to them? Okay,
I
and
do.
today at 3:30 at the Oregon Workforce Partnership COVID Recovery and Workforce Modernization Act of 2021. That's a virtual meeting. Wednesday at 4 p.m., FEMA briefing for local offices, officials. That's today at 4 o'clock. That's a virtual meeting with FEMA. Tomorrow, the 14th, at 7:30 a.m., a Kaiser Marion County meeting, location Salem Kaiser Council Chambers. I believe the two of you are going to try to go. I have a United Way Executive Committee meeting.
Just one correction, it's just the Kaiser Council Chambers. Salem has their own.
Good point.
What?
You said Salem Kaiser
she's from
Council
Kaiser.
Chambers, and I'm from Kaiser.
Yeah.
We have our own, the Civic Center.
Did I say Salem?
You said Salem
Okay, it's
Kaiser.
just like ballroom, you know, you're gonna have to just live with me.
Okay.
All right, on the 14th, Thursday at 9 a.m., work session VHF, UHF Radio Communication Systems Alternatives here in the Commissioner's Boardroom on the 5th floor. Also on the 14th at 1:30 p.m., a work session Mid-Willamette Valley Community Action Agency Letter of Support Request here in the Commissioner's Boardroom on the 5th floor. Friday the 15th, 11 a.m., Oregon Health Authority Commissioners Coronavirus Weekly Call. It's virtual at 11 a.m. And Monday the 18th, it's a holiday. We will be closed. The offices will be closed. On the 19th, Tuesday at 9 a.m., a calendar review here in the Commissioners' Boardroom on the 5th floor. Tuesday, the 19th at 9:30 a.m., a management update on the 5th floor at Commissioners' Boardroom. And on the 19th, Tuesday at 3:30, Health and Human Services Policy Group location here in the 5th floor Commissioners' Boardroom. Wednesday, we're back here for board session at 9 a.m. Wednesday at 11 a.m., the Board of Commissioners Policy Meeting on the 5th floor in the Commissioners' Boardroom. And Wednesday at 4 p.m., FEMA briefing for local officials at 4 o'clock, virtual again. Commissioner, how was your first week? No, this is your second week.
It is my second
She's a
week.
veteran now.
Yeah, actually, I'm having a really good time. I mean, there is a lot of work, I'm not gonna lie. I have never been to so many meetings, ever. But everybody here is really welcoming. I've had great conversations, and I don't know, I'm blessed and I'm thrilled. I mean, I'm not gonna lie, I wish COVID wasn't a thing and I could really get into the deep work of really what the county should be doing for our citizens. But it's no secret that I'm compassionate and really love my people. So whatever I can do for them during the COVID crisis is, at this level, has been new and emotional, frustrating, but it's been great. And I think, what is today? It's my 8th day, I think, and it feels like my 80th day.
So I'm not sure what meeting we were in yesterday or the day before, and I said, we were talking about some off-the-topic subject, and I said, oh yeah, what do commissioners do? I mean, you've gotten all kinds of different things already.
Oh my gosh, I had no idea. Well, I'm personally appointed to 15 committees in Marion County. That's just me. And it turns out, it seems like they meet every week. But in addition to that, I mean, there's just so much work that requires the three of us to get together, and we have the best staff, the best. I'm so thrilled with the process so far. So.
It's got to be an adjustment for you, because I know you're like a hands-on person. You like to get out there, and I know when the evacuation happened, you were there hauling hay and making sure the animals were actually in their places, and now you're just in meeting after meeting after meeting after meeting. That's got to be a bit of an adjustment.
I think the only adjustment is that I feel very much like I'm still participating and doing the work. I just have so much more that like distracts me from going back to my desk and executing or facilitating, whatever that may be. And that'll come. Let's not kid ourselves. At some point, I'll come up with something genius and have to dive into it, because you all tell me if you want it done, do it yourself, and that'll be okay.
Well, and I just know this about you. Obviously, you had another meeting last night that went into all hours of the night, as did I, by the way.
Yep.
Just in full disclosure, I was appointed to the City of Detroit Planning Commission last night by their city council.
Congratulations.
Yeah, they expanded it from 5 to 7, and some really, really good people that are stepping up there to help them with. And it was interesting listening to their discussion of setbacks and codes, and they actually mentioned Marion County, and they talked about our 1 year, if we apply, remember Brandon said if you apply for your building permit within 1 year, we're going to allow you to put it in your existing footprint. And their pushback, they said, well, we need to do something like that, but it needs to be extended more than 1 year. And I thought, well, that was good feedback. I'm learning from listening to our local jurisdiction up there to say, 1 year, here we are, since the fire. And then they said, well, we want, whatever years we use, they're going to adopt it from the time they adopt it, not from the date of the fire. So it'll be interesting to get that feedback sitting there, listening to some of the struggles within the city, in addition to what we're doing outside the city. So
I think that connection is going to be really important, because we make decisions sort of understanding or learning more about what is the state doing, what is the federal government doing, more big picture stuff. But the application's super important. We kind of make the best call we can, but if on the ground, people are like, hey, that doesn't work, we need this adjustment, it's going to be great to have you there hearing that feedback.
yeah, and then there was another discussion that there's a gentleman up there that applied for a building permit prior to the fire. He was building a house. And he applied for his permit, submitted the plans to the city. They stamped them. They went to the county. He's dug his foundation. Our inspector comes out, because we do the inspection for the city. And the inspector says, you're not meeting the 15-foot setback here from the street. You're only 12 foot or whatever. So then the city council's talking about, well, this was a government mistake. The guy just assumed his plan. And then you could hear him say, well, this is a Marion County problem. And of course, I am sitting there listening to it, and I text somebody and I said, ask the question, who approves the setbacks?
I don't think it's Marion County.
No, it's the city who's supposed to approve those setbacks, and it was the city, and so, it's like, but those are the kinds of struggles that our small cities are dealing with, and they're gonna get in fact, I heard this last night at their city council meeting, which went to almost 10 o'clock, they were saying, we are just gonna start to get inundated with these building permits and plans, especially in that area, because people want to get back and going with the lake and stuff. So that'll be really interesting. The other topic, I think I shared it with Katrina here, is this COVID thing. I really appreciate that we're getting shots in the arm. I mean, that's the thing we need to do. And I heard pushback on Monday at AOC. Why did Lane County only get this, and so-and-so got this? So it is a double-edged sword. We need to get as much vaccines, and we've got a system set up here to get shots in the arm.
Well, and it's a credit to our health department and to Salem Health that they were able to move so fast. And, credit where credit's due. We've been pushing on the governor to expand who can get shots, and I'm glad she said that. She's opening it up to everybody over 65 and to educators. Those are two groups that all along we've been really focused on because they have vulnerabilities to this virus. So I'm glad that that's happening.
All right. Anything else?
I think it's important to say in that partnership with Salem Health that, there's been several Marion County partners that have stepped up to help Salem Health recently. Like Kaiser Permanente, I heard, was able to share vaccines because they had a different kind of process. And I'm really impressed at the collaboration in Marion County. I have seen it for years in Kaiser. We kind of have this Mayberry approach over there where customer service forward and we really want to help each other. But that really does exist and is very present in Marion County. And it's just really, it just feels good to see it.
Good. Well, one thing we need to find out is where is our testing going to get moved to, because that's important that we continue to test and that we also continue to do this, our face masks, social distancing, and we'll cross the path at some point in time where we have healthier people than we have today. So if there's nothing else, we will adjourn for the day. Good? We're adjourned.